Hi, everybody. My name is Jenna. I am a registered nurse. I have my master's in nursing and my public health nursing certification. I also have a bachelor's degree in health science, community health education. Um, if you have any future questions about nursing or health education, I would be more than happy to discuss them with you. I am guest lecturing today for dengue and Zika in the next lecture because they are very closely related to the career field that I work in as a registered nurse. I work in labor and delivery, so I deliver babies. And Zika in particular has a lot of fetal and maternal outcomes that are affected during pregnancy. I feel very fortunate to guest lecture on this. And then dengue, it's very interesting. They oftentimes get confused, Zika and dengue. But we recently had a case of dengue fever come through our triage unit at the location that I work at. I found it very fascinating. I had an opportunity to research it, and now I get to lecture on it. Let's get started. Okay, so let's start with the history of dengue fever. The earliest recorded instance of dengue actually comes from a Chinese medical encyclopedia, which dates back to 992 BC. This wasn't actually discovered until modern times when we were looking back at the history of Chinese medicine and seeing a list of symptoms that correlate with dengue fever. So it does go very far back, but we don't see epidemics and outbreaks happening until the colonial period. The word dengue is derived from the Swahili phrase kadinga pepo, which means cramp-like seizures. When we talk about the severe effects of dengue and the severe signs and symptoms of dengue, um, it it definitely falls in line with this. The earliest reference to dengue in the modern time was made in Brazil during the colonial period, and the first clinically recognized dengue epidemic occurred almost simultaneously in Asia, Africa, and North America in the 1780s. In the US, we categorize all the outbreaks that have happened in 4 phases. So 1600 to 1946 is the plan. This is where we started seeing dengue on the rise, and we decided to connect with countries and come up with a plan to eradicate the mosquito responsible, which is the Aedes aegypti. In 1947 to 1970, we categorized this as the eradication of mosquitoes. So they had very good success during this time with um, their prevention measures, and we'll talk a little bit about prevention towards the end of this lecture. In 1970 to 1999 is the resurgence. At this time, this is where they saw a pretty large increase of mosquitoes during this resurgence period, and their prevention measures kind of fell by the wayside. So by the time 2000 to 2010 hit, they had a marked increase of cases that occurred and number of outbreaks. In 2011 to 2017, the new era, this is kind of the time that we're living in now, they realized that there was coincidental observance after a great movement of people, which were caused by 4 global sporting events. In 2011, they had the Pan American Games in Guadalajara, Mexico. In 2013, they had the Confederations Cup. 2014 was the World Cup, and you probably remember hearing about Zika and dengue during the World Cup, and in 2016 the Olympics, which were all in Brazil. Brazil is a hot spot, and we'll look at a map in just a minute about where dengue can be found and why they are found in that area. The number of dengue cases reported to the World Health Organization increased 8-fold over the last 2 decades. So from 505,000 cases roughly in 2000 to over 2.4 million cases in 2010 and 5.2 million cases in 2019. So, who's it's one of those things where you're looking at the statistics and the epidemiology of this disease and kind of figuring, is it an increase of people? Is it a movement of people? Is it the temperatures? Is it the increase of mosquitoes and vectors in that area? So we'll talk a little bit about that in the next slide. So one thing I forgot to mention on the previous slide was that in the 1970s, only 9 countries had pretty severe outbreaks, but now in modern times, over 100 countries are endemic with outbreaks and dengue. So endemic just means that it's there to stay. So 100 countries deal with dengue on a regular basis. All right, so the dengue emergence through history. I just have a picture graphic here. It's essentially what we just talked about, just in a more graphic, linear timeline scenario, so it may be a little bit easier to read. 992 is when the Chinese medicine encyclopedia has records of dengue written in it. The first known description of dengue virus and its outbreak was in 1779. In 1906, researchers confirmed that dengue was spread by the mosquito. So this is when they realized, just like John Snow found a link to cholera, it's the same thing. They started realizing that the mosquito was the vector that was causing this disease. Dengue actually spread rapidly and wildly during World War I. And the map will show you where it's popular. And if you recall World War I and its placement and where we were fighting, you'll understand why there was such an outbreak. In 1970, the dengue is considered a major cause of child mortality in the Pacific and the Americas. And local cases of dengue were reported in the Florida Keys in 2016. Again, when we just talked about the Olympics happening in 2016, Florida is a hot spot in the United States just because of its location and its tropical and subtropical area, but it could have been acquired during the Olympics at that time. Okay, the disease description. So I have 4 pictures here. I like talking about the pictures first because I think everyone is drawn to photos. So let's just talk about them for a little bit. I have 3 pictures of what dengue looks like under an electron microscope, and it is a beautiful virus. It's got these star shape, almost like starfish shape designs on them. It's a circular virus when looked at under the electron microscope. And it's just a gorgeous, very beautiful disease. Not necessarily to have, but to view under an electron microscope. I do also have one photo of what dengue would look like on a slide looking through the microscope. You can see red blood cells all around it. There are 2 arrows pointing to it so you can see what the dengue virus would look like under a microscope. It's very fascinating to me. So let's talk about the virus that's responsible for causing dengue. It's called the dengue virus, or DENV. There are 4 dengue virus serotypes, and it is possible to be infected 4 times. Now, when you're talking about viruses, usually once you are infected with a virus, you cannot get the virus again. But with dengue, actually, you can be infected 4 times, and every subsequent time is a worse infection typically. So very, very opposite and very different than any other virus that you may have learned about so far, which I, again, think is fascinating. And we'll talk a little bit more about that in a couple of slides. So dengue is actually found in tropical and subtropical climates worldwide, mostly in urban and semi-urban areas. And this makes sense because mosquitoes are more comfortable in warmer climates. I don't know if you notice in California during the summer months, we talk about, and even in the rainy periods, to empty any standing water that has occurred because mosquitoes like that humidity, they like that water, they like warmer temperatures. And there was a time in my life when I went camping and we ended up staying in a gym and a school gym, and we left the doors open. We went on a hike. We came back, and there were thousands, millions of mosquitoes in this gym. Someone had left the door open, and it was really warm in there from the daytime, and they all just migrated in there because they didn't want to be in the cool air. In the evening air. So they migrated in there. So they like warm, they like kind of that humid environment. This is where they survive, which these mosquitoes that are infected with dengue are going to survive in those locations. So very tropical and subtropical areas. And then urban and semi-urban areas, obviously, because there are a large number of people there, so more people to infect. The global incidence of dengue has grown dramatically, with about half of the world's population now at risk. Although an estimated 100 to 400 million infections occur each year, over 80% are generally mild and asymptomatic. So, asymptomatic means no symptoms, and or mild is just like normal kind of flu-like symptoms. And we'll talk about symptoms in just a little bit. So here is the disease map that I was referring to. As you can see, there is a very distinct zone of this disease where it takes place, again, subtropical and tropical areas. The presence and prevalence of dengue in this map are categorized in three sort of different areas. High, meaning there's a large number of infections that occur there. Medium, just kind of an greater than low infection rate, and then low, meaning more than zero. In the United States, Florida is a high prevalence of dengue. Again, it's much more tropical, much more humid, year-round warmth, mosquito haven. In Texas and kind of the southern states, as well as even the very, very, very tip of California, you can find dengue. It's more rare in California, but it can happen. Mexico and South America are very, very high prevalence. The tropical climate there is just a breeding ground for dengue and these mosquito infected with dengue. Asia has a pretty high infection rate as well. And then as you can see in Africa, there is a kind of a smattering of high and medium areas in this same kind of zone that it's showing here. Signs and symptoms. This is probably my favorite part of this as a nurse. We talk a lot about signs and symptoms, how to treat, how to prevent. So this is probably one of my areas of expertise on this. And I can talk a little bit about the patient that I had that came in and the things that she was experiencing. So I have two different pictures here, one for more of the visual people and one for more of the analytical and just needing it to be very organized. So on the left-hand picture here, the one with the visual representation of all the different things. Fever is very common. Anything over 101 typically is indication of infection. You talked a little bit, I'm sure, about the immune system and homeostasis and how your body tries to kill off these diseases. So fever, trying to get rid of and kill off this virus. Headache is common. It says retroorbital pain. That just means eye pain, pain behind the eyes. So, that headache and that pressure and everything like that can cause pain behind the eyes. Epistaxis, that's a fancy word for nosebleed. So this is a hemorrhagic disease. This can cause leaky vessels and leaky capillaries. So you tend to bleed out of areas of opening. So, nose, sometimes eyes, mouth, etc. Nausea and vomiting. This is kind of very prevalent in any, same with headache and fever. These happen with a lot of different viruses. So nausea and vomiting. Many people have nausea and vomiting because it is a oh goodness, a response to pain that just makes them feel sick and just kind of yucky. Myalgia, that's muscle pain. Mya is the Latin term for muscle, and algia or algia is, or even angina is for pain. Blanchable, macupapular rash. So macupapular rash is just talking about a type of rash that can occur. It's not like dots. It's more like um, almost like hives. And then blanchable means if you touch it, the redness goes away and it turns white briefly. And so it shows in this picture kind of a hand. So you touch it, and let go, and it's white for a moment, and then it turns back to red. Scattered petechiae, this is the more dots on your skin. And this is a rash. It looks like chickenpox kind of, but not like the papules of chickenpox. So they're not pus filled. They're just like raised dots. And then bony pain and pain in your joints is common. He's also holding a little sheet that says platelets less than 150,000. So it does cause issue with your platelets and causes low platelet count. In the picture on the right, dengue symptoms, fever with any of the following. So it's basically saying that fever, if you have dengue, you will have a fever and one or more of these symptoms. So fever obviously is number one right there on the right hand side. It can come with eye pain, muscle pain, bone pain, joint pain, which is bizarre that they have bone and joint pain, but bones and joints are different. So joints have more fluid in them, so they move. So any moving in your fingers, arms, and kind of at those bends, that's going to be your joint pain. Bone pain is more deep in your body, feeling like your bones hurt. Headache is very common, nausea and vomiting, and rash like we talked about. The patient that came into labor and delivery presented with a lot of mosquito bites on her body. She had recently visited a hotspot area, Dominican Republic, and they were having an acute outbreak of dengue at the time. She also presented with a severe headache, nausea, vomiting, fever, achiness, and no nosebleed yet, but a lot of times that can come later in the disease. So there are different signs and symptoms for a more mild case and severe case. And I believe the next slide will talk about severe symptoms. These are just more mild. They don't all have to occur. They can occur, like I said, with a fever and one of these symptoms. Everybody experiences this disease a little bit differently. Okay, so severe signs and symptoms. So usually what will happen is you will have a more mild case that becomes severe. You don't automatically just go straight to severe. Usually if the supportive measures that you use and treatments that you use during a mild case aren't working, and it just gets out of control in your body. So severe dengue can cause internal bleeding, and that's like what I was talking about with that hemorrhagic disease. So it makes those very leaky vessels, and you start, nosebleed, bleeding from your eyes and mouth. Internal bleeding is inside your body, so any organs, so your organs will start leaching blood, filling up your lungs, things like that. And you'll have bleeding inside your body that is not released outside of your body. Organ damage, this is kind of, again, it's very severe cases. Your organs will start shutting down and not working properly anymore. And then that can cause residual effects after you recover. If you recover from these severe symptoms, you can have damage to your organs for the rest of your life. Blood pressure can drop to dangerous levels, which will cause shock. There are different things that can cause you to go into shock, but blood pressure is usually number one, and it will drop rapidly and significantly, and your body cannot handle it, so it kind of shocks your body, and it's harder to recover from that. And then in some cases, severe dengue can lead to death. It's pretty low, and we'll talk about that if you have supportive care, if you're in an urban area and you have access to health care. It's very, very rare that you die from dengue, but before that, when we didn't have modern medicine, it was more common to die from dengue. Causative agent. So I've already mentioned that this disease is caused from a mosquito. So it is a vector disease. This disease cannot be caused from human to human transmission, only vector to human. So if you have dengue and you go to class, you can't pass dengue to your peers. If there was a mosquito in the room and it bit you, the infected person, and then it bit another person, then you can get dengue. But without that vector, it will not be transmitted from human to human. There is an instance of vertical transmission, and we will talk about that coming up here. So the mosquito is very high transmission rate with dengue. So the primary vector mosquito that transmits this disease is the Aedes aegypti. It's a female daytime biter. It's usually biting after sunrise, but before sunset, and its lesser secondary mosquito, the Aedes albopictus mosquito, also is a daytime biter, and it can transmit the disease, but it is typically limited in numbers, and usually the Egypti is not present in that same area, or they're present in very low numbers. So the primary disease vector of the mosquito of this disease is the Egypti. Again, the albopictus can transmit the disease, but it's just much more limited. So the other way that you can get dengue is maternal transmission, and this is what I was talking about, that vertical transmission. So technically it's not human to human because your baby is growing inside of you. Maternal meaning you're pregnant here. So there is evidence of possible maternal transmission, again, from pregnant mother to her baby while pregnant, but it is very, very low risk, and it's seems to be linked to the timing of the dengue infection during your pregnancy. So at what point did you acquire the dengue infection during your pregnancy? Was it in the beginning? Was it in the first trimester, second trimester, third trimester of your pregnancy? So when a mother does have the dengue infection when she is pregnant, babies usually suffer from preterm birth, low birth weight, or fetal distress. Fetal distress is actually very common we see a lot of cases in high-risk cases already of fetal distress, but this is severe fetal distress. Like your baby needs to be delivered immediately. Preterm birth just means birth before your term, which is 40 weeks or 38 weeks. And then low birth weight, that just means they are born underweight typically, even if they are term birth. So again, it really depends on what period of pregnancy you're in, what time of pregnancy you're in, if you get dengue, and if it will be passed to your child. So that's all I really want to talk about on that because it's such a low possibility that that can occur. Blood products. So this is a very rare instance, but if the blood has dengue in it and you receive a blood transfusion, meaning your blood is you're receiving blood from somebody else who has donated blood, or, organ donation, anything like that. It has been recorded, but it is very, very rare that this happens. Risk factors. So This is pretty straightforward. Like I said before, this is a very interesting disease. So you're actually at greater risk of developing dengue or a more severe form of the disease if you've had dengue fever in the past. So if you've had a previous dengue infection, it increases your risks of severe symptoms later on if you get it again. And then you're more susceptible to getting dengue if you've already had it. So not just severe, but you're increased risk of getting it again. And then we talked a little bit about this when I showed you the map. If you live or travel to a tropical area, tropical or subtropical area increases your risk of exposure to the virus that can cause dengue fever, especially high risk areas, including Southeast Asia, Western Pacific Islands, so Cuba, Puerto Rico, Dominican Republic, things like that, Latin America, and Africa. As I stated in the very, very beginning of this lecture, dengue can actually be confused with many other diseases that are found in tropical climates and that are vector diseases, Zika, for example, and malaria, but also typhoid fever. So there's similar symptoms that occur. Um, so in order to figure out how you have this disease, you're going to give a really good medical and travel history to your physician, including any international trips that have happened in detail, meaning dates and times that you visited. Was there an outbreak during the time? Many times you can find that on the CDC or the World Health Organization. And then any contact you may have had with mosquitoes. So did you get bit by a mosquito? You pretty much know if you did. Most people become a little bit itchy and have a raised bump. So, it's pretty obvious if you have been bit by a mosquito. Some people don't have a great reaction to mosquitoes, and some people have more, larger mosquito bites. And then, of course, you can draw labs and look at your blood to see if there is an infection. Like I showed you in that slide, you can see the dengue virus in the blood slide. Let's talk a little bit about treatment. What do you do if you get dengue fever? So there's really no specific treatment for dengue or severe dengue, but early detection is key. So if you detect it early, if you start noticing these signs and symptoms and you go to your doctor, if you have access to proper medical care, it really lowers the fatality rate of severe dengue to below 1%. And as I said in a few slides back, it's very rare that you can die from this disease because we have supportive therapies to help and get you through this disease. Supportive therapies in the hospital are going to be things like, so if you have severe dengue, you're going to get things like IV fluids, electrolyte replacement, supportive care in dengue, giving Tylenol for fevers, blood pressure monitoring. So if your blood pressure dips, like we were talking about with shock, we can actually increase your blood pressure by giving you more fluids and doing things to, quote, resuscitate you. And then a transfusion of blood if needed. So they will actually replace the blood that you have. Remember, one of the signs and symptoms is low platelets, so they can give you platelets to kind of bolster your platelet count and your blood. If you have just a mild form of dengue, it's going to be supportive care at home. So over-the-counter drugs like Tylenol or Motrin can help reduce muscle pain. Tylenol will help reduce your fever. But if you have dengue fever, you should avoid other over-the-counter pain relievers. So no aspirin or naproxen or anything like that. If you remember, hopefully, this is a hemorrhagic disease. So really you shouldn't take Motrin because it thins your blood and aspirin especially can thin your blood. Motrin can cause ulcers in your stomach, so it can cause bleeding in your stomach. If you have a severe case or even a mild one, you don't want to accelerate any of this bleeding and potential bleeding. So Tylenol is a good one. You could take Motrin if your physician said it's fine. But yes, those other ones, naproxen, aspirin, and things like that, can increase your risk of dengue fever bleeding complications. Prevention, how to not get bit by mosquitoes. So dengue prevention and control depends on the effective vector control measures of the area. Sustained community involvement can improve vector control efforts substantially. So remember back in the history of the phases, how there was a resurgence of mosquitoes and that prevention kind of fell off the wayside. Well, we're really trying to uptick our vector prevention, talking widely about, reducing standing water in our homes. We do this every winter. Just make sure you dump out your pots that fill up, or your watering cans or tires that fill up with water, etc. So we'll talk more about that in just a second. There are approved vaccines where dengue fever is very common around the world. And the one dengue vaccine that they have is called Denguevaxia, and it is approved for ages 9 through 45 who have already had dengue fever at least once. And now this is very, very important. It's not for people who have not had the disease. Remember, I mentioned that if you have had the disease before, you're at increased risk of getting it again and getting it more severe. So if you have never had it and your body is being introduced to it, you can potentially have a severe reaction. So this is only approved for those who have had dengue at least once. The vaccine is given in 3 doses, just like hepatitis B or other common vaccines in the United States, and it's given over a 12-month period. Tips to reduce mosquito bites. We hear about this all the time in the U.S. because we don't want to get bit by mosquitoes, right? Stay in an air-conditioned or well-screened housing. So well air-conditioned housing, remember I was talking about mosquitoes don't like cool areas. They like warm, kind of humid areas, and they will travel to the warmer areas. So if your house is not air-conditioned and cool, they're going to come into your house if it's cooler outside. Well-screened housing, this includes mosquito nets in your house. So sleeping with mosquito nets around your bed. If you live in a area that dengue is prevalent, you want to have a mosquito net around your bed. And then well-screened, making sure that your windows have screens on them, your doors have screens on them, just to reduce them coming into your home. Mosquitoes are most active from dawn to dusk, but they can bite at night too. If you're living in a warm area, they can still be out. Wear protective clothing, so long sleeve shirt, long pants, socks, and shoes. When you have things covering your body, it's less likely for a mosquito to penetrate that and get to your skin. Tight clothing is a little bit different, like leggings. Mosquitoes can sometimes get through those. I don't know, maybe you've noticed that in the past. You've worn leggings or a tight shirt and you still get mosquito bites. It's pretty thin material and it's tight to your body, so it's easier access for them to get to. If it's kind of looser clothing, like a flannel shirt or jeans, it's harder for them to get through that kind of stuff. So just be aware of the protective clothing that you have on. Using mosquito repellent. So I've never heard of that one before. Permethrin. This is for clothing and fabric. So permethrin, you can apply to your clothing, and there are actually some clothes that have this already in them. If you live in a hot spot where dengue is, it's more likely to find clothing that already has this kind of built into it. And then you want to wear a 10% concentration at minimum of DEET for your skin. Military grade actually has, I think, one that's like 70 to 90% DEET, which is really not great for your skin. But hey, if you're going to an area that you could potentially get dengue from or any other vector disease, you might want to invest in that. And then reducing the mosquito habitat. So again, standing water, pouring out water of tires and anything that can collect water. Making sure that water like pools are treated. You don't really want to live near ponds because that's a significant breeding ground for mosquitoes. All right.